My name's Katie, and I'm going to talk to you guys today on how to treat benign paroxysmal positional vertigo, or BPV for short, or vertigo for short. What is PPV? It is a vestibular disorder with the crystals in your inner ear when they fall out of place, usually with a shift in your head position due to gravitational force. It makes you have this spinning sensation that usually lasts about 60 seconds. It's common in the older population, and women are more likely to get it than men. But anything with a vertebrae can get it, including my cute dogs. So, to test for vertigo, the physical therapists use the Hallpike test, which anybody can do this. It doesn't have to be a physical therapist. There's YouTube videos on how to do the Epley, which we'll get to in a minute. A positive test result has nystagmus, which is uncontrollable eye movement. And the patient reports dizziness as well. So to do the Hallpike test, the patient is laying on a treatment table and turns their head 45 degrees to the side that they think is causing the vertigo. And the therapist, or if you're helping your friend out, you lean the person back rapidly and you look into their eyes. If they have the nystagmus, then and they say, "Oh, I'm really dizzy." Sometimes they get sick. They have vertigo on that side. It can be left-sided, it can be right-sided, it can even be both. So, treating vertigo, the medications that the doctor can give you only treats the symptoms. So it'll only treat the dizziness. It won't get rid of it, and it'll keep coming back just by taking the medication. There's also two maneuvers. We're going to talk about the Epley maneuver today, and there's the CMOT maneuver, which is more common over in Europe. So the Epley maneuver, step one, the patient sits on the treatment table, again like you're about to do the Hallpike test, head 45 degrees to the positive side, and you lean them back so their head is overhanging the table. After 1 minute so step two, you lean them back over the table, and their head hangs off, 45 degrees. After 1 minute, you flip the patient's head to the negative side at a 45-degree angle. Another minute has passed, and you have the patient turn onto their side, again, heads at a 45-degree angle, and they turn their nose to the ground. After another minute has passed, you have the patient set up, and the patient is then in the same position that they were last laying down on their side, so they are kind of facing the examiner. So after treatment, vertigo can come back, and it can take a couple times to fully get the vertigo gone. We usually see patients 2 or 3 times when they have vertigo, and they tell you not to look up or down rapidly, because that can cause the vertigo to come back, and to sleep at a 30-degree incline to avoid accidentally rolling onto your side as you sleep. Again, the Epley maneuver is performed multiple times during the session. It's not usually done one time and then they kick you out. They do it a couple times until you don't have the nystagmus anymore, and then it does take several treatments to achieve